So you heard from three experts with scientific backgrounds, and now you're going to hear from me. I, I am Nate Erskine-Smith. I'm a member of Parliament in Beaches, East York, and East End of Toronto. Once upon a time, I was a lawyer, but I've been doing politics for longer than that. And politics, you'll hear, is the art of the possible. I also think politics, though, is about making what's impossible today possible tomorrow. And I think that is especially true when it comes to animals, because lots of people care about animals. And we have an animal welfare caucus that started, I think, around 2016, 2017. On the Liberal side, we've had different all-party meetings. And we've heard from animal experts who will tell us time and time again, animals think, they love, and they feel, and they deserve our respect and compassion. And I hope we all know that to be true, because that is true. Now, some people will care about that, and they will change their behaviors, as some of the speakers before me suggested we should, and I think we should. Not everyone will, though, and so I think what's really interesting is people will sometimes arrive at the same conclusion, but for different reasons. Some people come to it for animals, and they will change their habits and their behaviors. That applies to me. That I was raised vegetarian because of my mom and because of a concern for animals. Others, though, and you just heard a ream of facts about the impacts on climate as a result of industrial animal agriculture. People who care about climate first and foremost will change their behaviors as it relates to animals. These things are interconnected. Same when it comes to our own health. We may not care about another species, but we certainly care about ourselves, and we care about our kids, and we care about those around us. And so our diets matter, and our health is impacted by the health of animals. You just heard Scott talking about antimicrobial resistance. The health of animals impacts our own human health. And so when people talk about One Health, I'm surprised we haven't heard that term more up here, but One Health is this idea that animal health, human health, and our environmental health, these are interconnected ideas. We cannot pull them apart. And I think it's a useful frame, not only because there's scientific fact behind it, but also it's how we pull more people into caring about these issues, because people they start from different perspectives of the things that they care about. Now, in Ottawa, we have seen some progress for animals along the way. I could tell a story about how, when I was just telling a story earlier, when I was first elected, I introduced a bill to strengthen protections for animals in the criminal code. It went completely sideways. It did not pass. Now, out of that effort, we have an animal welfare caucus, and we've seen the government subsequently act to modestly strengthen protections in the criminal code on animal fighting and abuse. We've seen the government take action to ban shark finning, for example. We've seen the government take action to ban the captivity of cetaceans. And I know marine land is now back in the news. Well, hopefully there's a whale sanctuary soon coming online in Nova Scotia. I think it will be online hopefully next year, and we'll hopefully see some of those whales saved and living a better life in the sanctuary in Nova Scotia. Still work to do. We've seen a ban on cosmetic testing. We have seen commitment legislatively to phase out toxicity testing, and there's a draft strategy at Health Canada to do just that. Unfortunately, there is no money. We've seen commitments around making sure that we ban the live export of horses for slaughter. An unfulfilled commitment. Jan Arden wants us to do it yesterday, and she's right, but we promised to do this, and we should do this. We have promised to make sure that we pass once and for all the Jane Goodall Act to protect animals in captivity. I was saying earlier to one of the fellow speakers, the strangest moment I've ever had in politics was being the House Speaker on the Jane Goodall Act, and Jane Goodall was zooming in, and the late Murray Sinclair was zooming in, and I was wondering how I could possibly be standing between these two icons. But it was because of a shared concern for animals. Now, I say all that, that's progress, and there's some progress that's been accomplished and some progress that we have yet to accomplish. But I don't think we have truly grappled with the systemic challenges that we face. And sometimes it's important, these one-off issues, look, they protect animals, they save animals, animals are better off, we strengthen animal protections. The way we talk about it, the way we remind people that animals matter, and this one-off issue is actually part of a broader advocacy movement of improving animal protections overall, is incredibly important. I think, again, we can change minds. The more you change minds, the easier it gets to change laws and change rules. I will say, though, when I think of system-level change, it will, and you've heard this from others, it does track back to food systems. And I had a pandemic prevention and preparedness bill, and I was told, remove the agriculture section. And yet it's central to pandemic prevention and preparedness if we take the science seriously. We have a food guide that is science-based, not lobby-based, for the first time in the country's history. That's a good thing. But we have utterly failed to operationalize that food guide. Now, you heard from one speaker an excellent idea, procurement. Imagine if provinces took this seriously and our hospitals not only reactively responded in a healthcare-focused way, but also served healthy food and incorporated preventative healthcare in what we do on the day-to-day. Imagine if the National School Food Program procured healthy food for our kids, better for our kids, better for animals, better for our environmental health. You could go down the list. Federal procurement, provincial procurement, government procurement would go a long way. I've tried for 5 years unsuccessfully in federal budgets of hundreds of billions of dollars a year. I've tried to get $2 million to train chefs of tomorrow to update culinary curricula across this country. We did it once upon a time in 2012 to reduce sodium in culinary curricula. Imagine we did it to update culinary curricula to operationalize the food guide so chefs of tomorrow understood that, of course, they're going to cook all sorts of different things, but they understood the science behind the food that they were putting on your plate. Imagine on the innovation front. We are going to wake up 20 years from now, and meat is going to come from very, very different places. If you have not heard of cellular agriculture, I encourage you to look into it. Meat is going to come from a very different place than it does today, because what we do today is incredibly unsustainable, and governments today should be funding those innovation efforts. So what is impossible today is possible tomorrow. And all that's to say, I encourage you all, when a politician knocks on your door in the next election, ask them what they're going to do to make sure environmental health, human health, and animal health are being dealt with together. Thank you.